Hi everyone, I'm Alicia, and today I'm joined by Dr. Bilski from Bilski Dental Group. How you doing today?
Good morning.
Good. So in this video, we're going to be talking about TMJ and migraine headaches. So how can the dentist help with that?
Everyone says that.
Mm-hmm.
You're a dentist. You're not a real doctor.
What does that have to do
right?
with my head? Yeah, of course.
Yeah. TMJ and migraines are all innervated by the fifth cranial nerve.
Okay.
Now that's a test question for doctors. Patients, you don't need to know that. But the area that we numb is the fifth cranial nerve.
Okay.
That's why you get numb all the way into the front here, up here, and sometimes you feel like your eye is numb.
That makes sense, yeah.
Okay. Back of your head, fifth cranial nerve, is activated or innervated by hyperactivity of clenching and grinding.
Right, okay.
So we get a lot of patients in from ENTs or physicians. I have a migraine. Well, no, you don't have migraines, you have TMJ. So they go hand in hand.
Okay.
The good news is the protocol that we use to identify if it's a migraine or if it is TMJ are the same. So you would come into our office, we have an evaluation, you bite into a technology that is a sensor that tells me if your bite is not balanced.
Right. And that's what we're seeing on screen.
And, well, this is the actual retainer that we wear now.
Oh, okay.
Most people that wear an anti-grinding or a bite guard this is called a data tube. And what that does is it only separates the entire mouth, and you're only touching on the front two and the lower front two.
Okay.
So it looks similar to a retainer. What we're showing here is that we have you bite onto that black paper, if you're familiar with the dental practice, and you have a filling, you bite on paper, we zip, zip, zip. What we're doing is adjusting, and we want to get to the point where we see the dots there. So you will see 1, 2, 3, 4 blue dots.
Okay.
We want to have one blue dot in the center. So what we're trying to accomplish here is identify where your lower jaw is meeting against that block that's separating the upper lower teeth.
Okay.
And then we would adjust the appliance so that you only have one dot. So for example, the one directly in the middle of that block is the one we want to keep, and we want to adjust everything else away.
Okay.
And then that free floats the jaw and puts it into a comfortable position. So your body is getting used to not having interferences because you're used to locking your bite in. So that's why you're clenching.
Yeah.
And then this gets tight, so the ankle bone is connected to the jawbone because the muscles of the chewing are in your shoulders, your neck, up into your face, your temples, your forehead, the top of your head.
And this is what people don't realize,
Back to your question.
Yeah,
you're a
bring us back
dentist.
to the beginning,
You're a dentist. Why would you do that? Well, because that's what we do. We're licensed to handle with injections or medications for the fifth cranial nerve, trigeminal neuralgia. That's one of the things that you would see a neurologist about. Neurologists cannot do what we do with the teeth. Yeah. So if we can identify that it's actually your bite, so just by this simple appliance, retainer, you wear it while you sleep. You can wear it all the time if you'd like. We recommend initially doing it while you sleep. Okay. Wake up, we'll probably see you for 2 or 3 appointments spaced out every 2 to 3 weeks. Right. And then once we know that you hit in that same spot with that one single dot, after 2 appointments, go right to it, we know that you're centered. Okay. And then whatever we have to do after that, if it's more therapy, it could be physical therapy, it could be putting crowns in, removing old crowns, adjusting your bite, as simple as just polishing it, smoothing it. Yeah.
So it's very easy, and it only takes a couple weeks to identify if that's the reason that you're having those migraines.
Exactly. And then if it's truly TMJ, that usually resolves itself. Yeah. Then you just maintain that bite guard, the data to appliance. And if it's more migraine, then that's when we go into the therapies, the cold laser or ultrasound, massage, exercise, and that could be anywhere from 6 to 12 appointments over a period of 4 to 6 months. Yeah. Too much to talk about right now.
But there's a lot of different ways
that appliance is very simple, and you get it from the dentist.
Well, thank you so much for telling me some more about that. And if you're someone who's suffering from those migraines and you're wondering if this could be a fix for you, you can contact Bilski Dental Group. You can call the number on the screen to schedule an appointment with Dr. Bilski, or you can visit online at bilskidds.com.